Morning, everyone. I am Janie Roundtree. I'm the Executive Director of the California Policy Lab at UCLA. And I just want to say thank you so much for joining our webinar today to talk about the results of research that we've done to detect whether time-limited housing subsidies are reducing homelessness for adults in Los Angeles. We were so thrilled with the response to this webinar, and we hope that you all get a lot out of it. And we look forward to your questions and feedback as we go along. I'm going to start by sharing a presentation. So I mentioned that I'm Janie. I'm the Executive Director of the California Policy Lab. And I'm going to start by just giving a little bit of background on the California Policy Lab so you know a little bit about your host today. I'm going to go over some housekeeping, including how and when to access the slides and recording of this session after today. And then I'll talk a little bit about the program that we're here to discuss today, time-limited housing subsidies for people experiencing homelessness and some of the policy context here in Los Angeles. Then I'll turn it over to Dr. Robert Santiano, who is our senior researcher here at CPL, who led this research with Brian Blackwell. He'll go over our research questions, the approach we took to answering them, and of course, go over the key findings, including answering the question of whether these subsidies reduce homelessness among adults. And finally, we'll wrap by hearing from Dr. Abby Miller, the new Chief Program Officer for the Los Angeles Homeless Services Authority. We're so happy she could join us here today. And she's really going to talk about what it's like to administer the time-limited subsidy program here in LA and strategies for improving them as we move forward. So thank you, Dr. Miller, for joining us. Just a couple of housekeeping notes. Please feel free to enter questions into the chat as we go along. You can enter them at any time. We'll be tracking them and we'll try to answer all of them before the webinar is over. We will post a recording to our website at capolicylab.org within a week and send a link to all program registrants. So if you know someone who wasn't able to attend today, they'll be able to see the recording. And we'll be sharing a PDF file of the slides as well. So if you want to take notes, please feel free, but no need. We will send you the slides afterwards. As a land-grant institution, the California Policy Lab at UCLA acknowledges the Gabrielino-Tongva peoples as the traditional land caretakers of Tovangar, Los Angeles Basin, and the Southern Channel Islands. When people ask me why we started the California Policy Lab 6 years ago, I often share the fact that the state government in California will spend more than the entire net worth of Mark Zuckerberg every year in social programs designed to help Californians. And a federal report estimated that less than 1% of government spending on social programs is informed by rigorous evidence and data. And our mission really is to try to fill that gap. We generate research insights specifically for government impact. We're trying to help those government agencies that are serving people do that better. We do that by forming multi-year, really intense collaborative research partnerships with local and state agencies here in California. And we work not only on homelessness, but we do work on public benefits programs, labor and employment, the criminal legal system and public safety, education, and health. And we do that because at the end of the day, we're really trying to understand people and their lives, and individuals are affected by all of these systems. If we want to understand solutions to homelessness, we can't just think about homeless services. We also have to understand people's interactions with things like the criminal justice system or safety net programs. Our work on homelessness covers a really wide range of topics, and the paper that you're going to hear about today is part of our effort to determine the effectiveness of homeless services here in LA. We also have a lot of work on predicting and preventing homelessness, racial equity in homeless services. We're the lead analyst for the Los Angeles Homeless Services Authority and the county and city to develop key performance indicators that are helping the system understand whether it's accomplishing its goals. We have papers on unsheltered homelessness and serious mental illness. Overall, we have research partnerships right now with 8 public agencies in Los Angeles focused on homelessness. We're a nonprofit research center, and if you're interested in our work, you can certainly read papers on all of these topics on our website. For this specific project, we partnered with the Los Angeles Homeless Services Authority, which is the main administrator for time-limited housing subsidies in LA. And we also worked really closely with the Los Angeles County CEO, Office of the Chief Information Office, or the CEO-CIO. And we're really grateful for their support and hard work over many years to make data available for research projects like this one. We specifically want to thank Max Stevens and Andy Perry at the CIO. Our own advisory board, CPL works with an advisory board of lived experts, frontline case managers and others to help inform our research, including this project. We're really grateful for their service. And we also worked with Meredith Berkson, Dr. Miller, and several external peer reviewers, including Dr. Shin and Dr. Phillips. So let's dive in. We're here to talk about time-limited housing subsidies. You may be more familiar with the program term rapid rehousing. And as you might know, on any given night here in Los Angeles, over 70,000 people are experiencing homelessness. The vast majority of them are unsheltered. And there are a number of solutions that are designed to respond to this crisis, including things like street medicine, street outreach services, shelters called interim housing here in LA. Those are emergency responses. But of course, the ultimate goal is to try to help people experiencing homelessness connect to permanent housing. And permanent housing can look like a variety of different things. You might know permanent supportive housing. These are units that are fully funded, including rent and supportive services, or frequently supportive services. But permanent housing can also include these time-limited subsidies, and they're designed to give one-time or infrequent, time-limited subsidies to an individual to help them achieve permanent housing in the private rental market. And that's the focus of our study today. To provide some context, there are not enough permanent supportive housing units to meet the demand in Los Angeles. There are a number of buildings coming online. People are working hard to build them, to lease them up and place people into them, but there are not enough of them to meet the demand. And these time-limited subsidies are filling the gap in some cases, or serving people who don't need supportive services. Our estimate is about 64% of enrollments in permanent housing programs in Los Angeles are time-limited subsidies. So they're a hugely important resource for our system. Yet there's very little evidence to show whether they're working to end homelessness, particularly among adults. And so we're trying to fill that gap with the study and help Abby and others who administer this program understand how and whether they're working to end homelessness. And there are quite a few challenges, as you might imagine, to this program in Los Angeles. We have a very expensive, tight private rental market. So it's a really important question to answer as to whether these subsidies are effective. Let's talk a little bit more precisely about what we mean by time-limited subsidies in Los Angeles. As I mentioned, they're sometimes referred to as rapid rehousing. When you enroll in the TLS program, you're often provided case management and housing navigation. Housing navigation is designed to help that person try to find a unit on the rental market. And then, of course, this flexible financial subsidy to live in the market rate unit. Total subsidies per adult here in LA are capped at $6,000 to $8,000, and we spoke to providers about this amount, and that seemed right to them per participant. The money can be used over a 2-year period, but some people will use it all up front to move into a new unit and pay first and last month's rent. Some people might use it for relocation expenses. Other clients might use it monthly across the 2-year period. There's a lot of variation. But per client, it's $6,000 to $8,000 over a 2-year period. This program was originally designed for households that do not need intensive services, but here in Los Angeles, we've seen a wide variety of people enrolled in the program with a wide range of needs. And so one of the things that Dr. Santiano will cover is sort of what we've seen in terms of the impacts of the program across a wide variety of different types of clients. Before I hand it over, I just want to acknowledge that what we're doing today is presenting a lot of administrative data and quantitative analysis around the impact of this program. We We feel that this kind of research has a real role to play in help informing policy decisions and knowing whether our programs are effective. There are limits to data analysis, and I just want to say that data does not do a great job of describing people's personal experiences in these programs. We talked to a number of clients and providers about those experiences. But if you're listening in today and you have an experience with this program, we'd love to hear from you. And I just want to acknowledge that while data is really important, it's not the whole story. And we look forward to hearing from you if you'd like to share your experiences with the program. With that, I'm going to turn it over to Dr. Santiano to talk about our impact evaluation.
All right, so hi everyone. My co-author Brian Blackwell and I are very excited to share this work with you that is the result of a very collaborative effort across many people. And Janie, thanks so much for providing that background and context. So I'm now going to move to the impact evaluation and what we learned from this study. And as Janie mentioned, we have a pretty broad audience, or maybe she didn't mention that, but we know we do. So I'm going to keep this at a relatively high level, but we provide very nitty-gritty details in the working paper. And if you're interested in such details, I strongly encourage you to look there. Starting with the research questions, our first one is a pretty straightforward one. So the first research question, since this is a program that tries to get individuals access to market rate rentals, we ask whether TLS participants are able to move in and use a subsidy. And if you're familiar with research in the housing voucher space, you won't be surprised to hear that we actually find a good number of individuals are not able to move in into a unit. So that's actually where we start. The second question we ask is really the big one. Essentially, does enrollment in TLS reduce future homelessness over a 4-year period? And I want to take my time here because there are a few things to unpack about this question. The first is that we include all TLS participants as the program group, even though many do not actually use the subsidy. This might seem odd at first, but it's very important for the credibility of the research design. And we also think it's the policy relevant question. Specifically, the main policy lever we might have is to be expanding enrollment in TLS, but that does not mean that everyone will be able to use the subsidy. And it's important to take into account that when assessing the effectiveness of a program. The second thing to note is that we're measuring homelessness using future enrollment in street outreach and interim housing. Something that is really challenging in this space is that we don't have perfect measures of homelessness or housing stability. But we do know that these services are intended for people who are not stably housed, which is why we rely on them here. And finally, and very importantly, we look at outcomes over a 4-year time period, which allows us to look at impacts beyond the typical 2-year time limit of the subsidy. So with all that said, overall, we do find that TLS enrollment leads to future reductions in homelessness, not only in the 2-year period, but when the subsidy could have been received, but also across all 4 years. So extending those findings, the third and fourth questions we ask then move on to important subgroups. So for question 3, we look at impacts separately for Black, Latinx, and white participants and find that there are reductions in homelessness for all 3 groups, but there were differences across them that we'll discuss. And the fourth and final question, we look at impacts for TLS participants at different risk levels for future homelessness. And Janie was kind of queuing this up, but this is a really important question because it allows us to consider TLS in a broader service context. Specifically, it is very true that permanent supportive housing is constrained in Los Angeles. And it's also true that TLS has been more broadly used to serve populations that may have different barriers to housing. And so recall that TLS was originally designed as an intervention for individuals who may be experiencing a temporary financial shock and need a quick temporary solution. So by looking at impacts by risk of return to homelessness, we can learn whether the program is working across populations with potentially different service needs. And as we'll talk about in a minute, we actually do find that TLS reduces homelessness across these 3 separate risk levels that we use. And we'll talk about kind of what that means in just a bit. All right, so now going on to the next slide, I'm going to briefly talk about how we answer these questions, starting with the data and sample we have available. The data we're using is called the Information Hub, which is an integrated, individual level, and de-identified data set that is maintained by the LA County's Chief Information Office. We have to say this really is a novel data set that is the result of a large and very important investment by the County of LA, starting back in 2006. And it now represents a critical piece of data infrastructure for analytical and operational use cases in the county. And from this data set, we rely on 10 years of data from 6 county agencies, including health, mental health, social services, homelessness services, sheriff, and parole. And with that data set in hand, we build our main study sample, which consists of 3,677 TLS participants who enrolled in the program from July 1st, 2016 through June 30th, 2018. And we also have 29,843 comparison individuals who are enrolled in homelessness services over the same time period, but were not enrolled in TLS or permanent supportive housing during a study enrollment period. All right, so now moving on to the research design. Using this sample, we implemented a few different strategies, but our primary one was to compare outcomes for individuals who enrolled in TLS to outcomes for similar individuals who are not enrolled in TLS. And when we say similar, we really mean that we identify statistically identical samples on the following things. So the first one is the time and place of entering the homelessness service system. So we only compare individuals who enter the system in the same regions and made sure that they enter during similar times of the year. So we're really matching on time and place before making any comparisons at all. The second is with how individuals respond to items on the vulnerability screening tool. And this is really important because these responses result in one of the inputs in determining how individuals are prioritized for housing resources, at least during the time period of the study. We also use additional information from the tool related to relationships and contactability that aren't part of the vulnerability score, but are important for understanding housing stability. The third thing we include is information on demographics, including age, stated gender, and reported race ethnicity. The fourth is a 5-year history of interactions across all 6 of those county agencies we use from the Information Hub. And this also represents another set of very critical variables where we can really match the interactions across TLS and comparison groups in a very flexible way. And finally, we make sure that individuals are engaging with similar homelessness service providers in terms of those providers' intake flow and the past homelessness experiences of their participants. This last one is really important in that it ensures we're not comparing individuals who are receiving services from providers that serve very different populations. And so taking all of these characteristics and context into consideration really builds our confidence that when we finally compare outcomes for these 2 groups, the main difference between them is whether or not one had access to TLS versus didn't have access to TLS. And so we can attribute the differences in outcomes directly to the program. Now, there are many tests to this strategy that we include in the working paper where we really kick the tires of the design. And there we provide evidence that the strategy holds up under a range of different analysis decisions. And for those who like those types of details, we think it's very fun reading and highly encourage you to check it out. All right, so now we want to talk just a little bit more about the primary outcome for the study before answering the research questions, because you'll see it, how it's presented in the working papers is a little more detailed than what we have here. But as discussed, we're measuring future homelessness as enrollment in street outreach or interim housing. But we're measuring time in 2 distinct ways. First, we measure it annually. And if you look at the figure here, we will be showing impacts for year 1, year 2, year 3, and year 4 separately. And the value here is that we can measure impact during the 2 years of the time limit, as well as for 2 years after the subsidy should have ended to test that the program had a longer lasting effect. The second way we measure the outcome is across all 4 years together. And this is really important because it provides a summative measure of program impacts over this longer time period. And I want to be very clear that not many studies have had access to the data necessary to look this far out. So looking at this time window is part of the big contributions of this work. And it's thanks to the Information Hub. All right, so with that background, we're ready to start answering some of the research questions, starting with the first one on where we found that 62% of TLS participants eventually use a subsidy to move into a rental. In other words, 1 in 3 participants do not move into a TLS supported unit. And we pointed to this before, but this is not a challenge that's unique to TLS. So a recent study on tenant-based vouchers in Los Angeles similarly showed a 65% leasing rate. And this lease-up challenge is reflected really across the country and highlights the idea that being offered a voucher does not guarantee its successful use. And we're just documenting that here again. At the same time, our ability to measure that gap between program enrollment and move-in rates, we think that's very important so that we can continuously measure where improvements are needed to kind of help bring that rate up, or test strategies to do that. Now moving on to the second research question of overall impacts. Here we present a bar graph that represents the percentage of individuals who experience homelessness by year and across all 4 years for TLS and comparison groups. And if I can first have you focus on the right side of this figure, the first takeaway from the summative measure is that TLS enrollment leads to a 24% reduction in homelessness across the full 4-year period, which we take as a positive finding. At the same time, if you also look at the rightmost blue bar, 29% of TLS participants are still experiencing homelessness over this time period. So there is good happening, but there is still room for improvement. The second main thing to take away from this slide is the annualized impacts for each of the 4 years on the left part of the figure. And so you'll see the rates are going down over time, but there's also evidence of a reduction in homelessness that is independently occurring in each of those 4 years for the TLS group. This is the first evidence we know of where we can see that the impacts extend beyond the expected 2-year time limit of the program, which is evidence that TLS is providing long-term stabilizing effects for some individuals, even though the program is time limited. All right, so now moving on to the next question, we now present impact results by race ethnicity groups, focusing on just the summative 4-year measure. What we can see here is that there are reductions in homelessness for each of the groups, but there are differences across them. Specifically, Black participants experienced a 19% reduction in homelessness, compared to 31% for Latinx participants. And it is important to note that the rates of move-in were actually similar across the groups. So that is not an obvious explanation for why the impacts are different here. So this really motivates additional work that's needed to be done to better understand why these differences exist and what could potentially remove them. For example, we don't know much about the quality of rentals and how they may differ across groups, which could lead to differences in whether individuals are able to maintain those rentals or whether they even want to maintain them over time. So definitely room for more research there. And so for the last research question, we finally now turn to the related impacts by risk of future homelessness. And again, the bar charts here represent 4-year homelessness rates by group. And we can see that TLS enrollment again leads to persistent reductions in future homelessness across the 3 different risk levels. We have low, medium, and high. And in fact, TLS leads to a 25% reduction for each risk level. It's 25% for each of them. When considering the motivation for creating the TLS program, these results are a bit surprising, and we weren't necessarily expecting them, but there has been research in other contexts such as New York that have found similar trends of higher impacts for those considered to have higher risk. Importantly, the higher rates of homelessness for the high risk group implies 2 things. One, the magnitude of the reduction between the 58% and the 44% are largest for the high-risk group. So in magnitude, relatively, more people in that group are not returning to homelessness. And the second thing is that the differences in homelessness rates across the groups, so that's the 20%, 31%, and 44% for TLS, that really highlights the potentially different needs for populations that are participating in TLS. So to us, this is a signal that TLS, as it currently is, may need to be, adjusted or thought about, and it may not be enough to kind of think about the specific needs across those different risk levels. And so in conclusion, what do we conclude from all of this? First, we find evidence that TLS is reducing homelessness for adults in Los Angeles. And despite it being a persistently tight rental market, it was tight at the time of the study. It continues to be tight now. So these impacts exist in a tight rental market, which I think was a big question a lot of people had about the program. Further, these reductions exist across a range of populations and extend beyond the length of the program. So combined, we think these are promising and positive findings. At the same time, there's definitely room for improvement. So as we found, 1 in 3 adults do not move into a unit. Return to homelessness rates are still 29% over a 4-year period, and some groups benefit more than others. And so we think this points to future research needs and strategies that could improve move-in rates or reconsider providing supportive services to higher risk TLS participants. And finally, we really want to acknowledge that we weren't able to perform a detailed cost-benefit analysis of TLS, especially compared to alternatives such as permanent supportive housing. And we think that research doing that well is going to be really important as we continue to think about strategies to combat homelessness in LA and across the country. And so with that, I will go ahead and hand it off to Abby to talk about the future.
Thank you. Thanks so much for having me here today. And I just want to start, before I talk about time-limited subsidies at all at LAHSA, thank the California Policy Lab for the work that you've done on this. I think in a field like ours, where we have so many external factors that impact the success of our programs, it's essential that we continue to evaluate and understand what's working and what's not. So I have deep gratitude to you all. Look forward to more of this on other programs. So how are we impacting the success of time-limited subsidies at LAHSA? I want to talk about a number of things that we are doing already, and we are seeing some improvements, and also much more work to be done. So the first is really this set of things that's about how we get more people leased up and moved into housing, and improve the providers who actually implement these dollars out in the world, how they can be better situated with their capacity. So one of the largest challenges that we have heard from providers is staffing. So what we've been doing are hosting job fairs and also working to connect folks with lived experience of homelessness and a variety of other social experiences that folks may have had. For instance, people have become unhoused due to domestic violence. That's a specific experience that we want to call out and lift up, and a variety of others. So we're working to connect folks who have these different and critical lived experiences of being unhoused, and getting them plugged into our field as employees, as staff at the providers. So we've done a good bit of work with Careers for a Cause. So there have been 260 participants through Careers for a Cause, and 132 of those have gotten employed within our network of providers. And I've seen some of the folks doing Q&A or writing in questions here today, who I know are also engaged in bringing folks with lived experience, particularly young people, into our field. So that makes a huge difference, both in numbers of staff that we have to work with and do good work, as well as the quality of the work. I think lived experience it really changes the quality of what somebody's able to bring to the job. LASA is also has been funding landlord incentives for a while. I think watch this space, I will say. We are getting ready to do more work with landlords. And I will just actually bump down to the centralizing landlord engagement. So we have been building out a master leasing effort that is really a unit acquisition strategy. This is a way to have a readily available, consistent pipeline of hard units that these vouchers can be used in, because we know that so many of the things that participants in time-limited subsidies and across our programs face is discrimination, official discrimination, and also practices that, while they might not be discriminatory, do create barriers to people becoming rehoused. So by getting more into the unit acquisition space, we're able to mitigate some of those barriers and have a more consistent lease up. Another thing that we've been working on, and I'm going to get really wonky here, so apologies for lay listeners, but the way that our system is set up in LA, we have historically enrolled folks in time-limited subsidies when they are starting to search for housing. And the way that that lines up with the funding and what providers have to do across those phases ends up with all of us underspending our dollars, which means underspending means fewer people served, means fewer people get leased up. So we have been aligning our program enrollments to actually later in the search process so that we can more reliably tag those dollars for each lease up and not let some of the dollars that would have gone to the subsidy get caught up in underspend at the end of a grant. Thank you for listening to that wonkiness. If it made no sense, I apologize. Hopefully it made sense to some of you. One of the other things we've been doing are hosting provider boot camps. So time-limited subsidies, we get these from a variety of sources, funding sources, and it's actually a lot of costs are eligible that people don't really know. Back to the provider staffing shortages, because we have a lot of turnover in the field, we have to continuously be educating everybody in the field about what is eligible so that they're thinking expansively and creatively about how we're using these dollars to help folks get back into housing. And then the last piece really focused on leasing up greater numbers is that, you know, in keeping with this whole this alignment of enrollments that I was talking about, we have been sharpening our focus over the last year on the core behaviors at every step of our system. Because LA is so large and the system is so large as well, we've had to, this is in the adult system, I should say, we've gotten very refined about what it is that needs to happen at each step of the system, rather than saying, you know, for instance, time-limited subsidy, as soon as you come out of this program, you get that, then we'll see. We're instead making sure that folks are hooked up with housing navigators who have a very specific set of behaviors that they are carrying out to make sure that somebody makes it to lease up. From that point, we're making sure that the time-limited subsidy is kicked in, the housing retention and stabilization services are happening, move-in is successful. So it provides some clarity in a system that can often get very murky. Then we're also doing some other things once people are moved in to help sustain the success of that move-in. First, using a progressive assistance model. This is essentially every quarter, every 3 months, there is a reassessment of where that individual or that household is in their housing journey, because it does not end at the point of move-in. We know that we have a lot of folks who end up returning to the street or to an interim housing situation because they haven't been able to properly stabilize. So those assessments along the way, and not saying just right out of the gate, you get 12 months, you get 24 months. It allows for an actual humane and human-to-human assessment of how that journey is going, whether somebody needs more assistance, whether they're ready to graduate on their own dollar, or I will bump down to this last set of bullets, go to a longer-term intervention. So we really have two pathways out of time-limited subsidies that are to another resource. And one is a step down in the intensity of the resource. So we do have shallow subsidies available that are 35 to 45% of rent. And those can be used for long term for folks who really, the lack of stabilization that they've found since move-in is because they just cannot make enough money to make the rent and their income balance out. We also have a stepped up resource intervention where we are connecting and transferring people in place. So same unit, there's no need to move, but we swap the voucher from a time-limited subsidy to a permanent supportive housing subsidy. Tenant-based, that means you can remain in place. But then that brings a higher intensity of services, and the housing subsidy itself is no longer time-limited. So that's really the full suite of work that we are doing to improve the time-limited subsidy program administration and implementation. And I think I'm passing it back to Janie.
Thanks, Abby. That was super interesting. I appreciate you being here today to share all of that. It sounds like a lot of work too. So that's really the end of our formal presentation. I'm just going to leave these email addresses and our website address up here for 1 second. As we mentioned at the beginning of the presentation, the full policy brief and working paper are available at www.capolicylab.org. We're really grateful to all of our funders, including, of course, the Conrad and Hilton Foundation, Arnold Ventures, the James Erndine Foundation, the Woven Foundation, as well as the UC Office of the President, who all contributed to this work. And at this point, you've all been very patient if you submitted a question. I'm going to introduce our communications director, Sean Coffey, who has been monitoring the questions entered into the Q&A. And he is going to tee up those now, and we'll use the remainder of our time to see if we can tackle your questions. So thank you.
Thank you, Janie. We had a few questions just generally on eligibility and how people get enrolled in TLS. So eligibility and then how you would actually get into the program.
Assuming you're kicking that to me, Sean. Okay. So there is an income requirement that somebody have income at or below 50% of the area median income. Let me see, I do have some notes here from the folks who are far more expert than me. So we're looking at for a single person household around 44,000 would be the cap. So we do have a lot of folks who are working in these programs. We also have folks who have no income. I think the flexibility of these time-limited subsidies and what Dr. Santiano has been presenting today, we can serve a wide variety of individuals, families, ages, and situations with this. Because we can attach it to other things at the end, like what I was just talking about, stepped up or stepped down interventions. And also because, we continue to not have we continue to not be able to predict with high rates of accuracy how somebody's going to do in housing. And because of that, the idea was to get everyone into housing and then figure out what it takes to stabilize them. So I think I went off a little bit on what are the requirements? And then the way that folks get in. So if it's the adult system, they're being referred from housing navigators. So that system with the clear behaviors that I was talking about, housing navigators, once they have worked with somebody to identify a unit and are ready to lease up, that's when the time-limited subsidy provider is brought in and the subsidy is attached. We try to make as much of the time-limited subsidy available as possible so that it's not tight, in its eligibility. For the family and youth systems, it's even a little more open. I did see another question in there that I can just wrap up in this response also, which was if somebody returned to homelessness, if they were living in an encampment and hadn't been re-engaged by an outreach worker, would they qualify as being homeless? They would. But the hard part there is you need to have contact with somebody to make sure that they're getting connected to the resources, which is really what the outreach workers are doing, among many other things. All right, I'll stop talking, being very long.
Yeah, and Abby, I also interpreted that question to mean, would that person be observed in our outcome? And unfortunately, the answer is no. We run into this problem all the time in research and homelessness. We can't see people who are not in the data. And so there are probably individuals who were in TLS who exited the program and became homeless, and we can't see it if they're disconnected from services.
Thank you. Rob, this one's for you, and I think we may know the answer to this, but if you could also speak to maybe some future research on it. The question is, can you speak some more about enrolled participants' challenges in converting their benefits into housing? Any breakdown on how much of the problem was payment discrimination, lack of housing stock, et cetera?
Yeah, that is a very challenging question, especially with the administrative data we have available. For that, a lot of qualitative work has been done, not by us, but by others. And it kind of ranges across the board. So we can't document it now. Definitely think it's worth diving into more. But talking to providers, one of the things we heard a lot about is just document readiness and preparedness at the time of lease up, and also just identifying the unit. So I'll just say that. Actually, I just want to also just take this time to kind of respond to something that was just said about the measurement issue. And I've actually seen quite a few questions come in on the methods and questioning what we're doing here. And I really just want to encourage again, check out the paper. Again, we really think it's fun reading. We really go through a lot of different details, and we've decided not to go to talk about too much of the weeds here on what we actually did here. But I did want to generally describe that in the paper, you will find that we did 3 different types of general tests of our strategy. So the first one is this thing called the placebo test, where we really wanted to see, does this impact exist in places where we don't expect it to exist? And the reason why we do that is if the strategy were to work, then we shouldn't see an impact, for example, in time periods before people enrolled in TLS, and then after because they weren't enrolled in TLS yet. And we find that it passes that test. The next one is a set of robustness checks where no matter how you're setting up this problem, there are going to be researcher decisions that kind of go into the analysis. And this really speaks to that question on measurement, right? So is street outreach or interim housing, is that the right measure? Because we know it's faulty and it can't pick up everything. So we actually try multiple measures, and we show that also in the paper and find that the impacts that we find are kind of robust and kind of they exist across multiple different measures. And the final one is a bounding exercise where, right now we're taking around 4,000 TLS participants and comparing them to around 30,000 comparison group. but you might wonder that maybe TLS participants were special or, positively selected in a way where they could take advantage of the subsidies. And so for the bounding exercise, what we did was we identified also a positively selected group from the comparison group just to see if the impact still existed there. And we found that they did. So there's a lot of detail that we talk about there. And I don't want to punt on all of those methods questions here, but please see the paper if you want to learn more about those details.
Thanks, Brian. Abby, you kind of touched on this a little bit, but there was a question about any insights on workforce demand for homeless service workers and why is there so much turnover in the field?
Yeah, this is actually a national phenomenon right now. If you all haven't been following the National Alliance to End Homelessness's work on this front, Alex, I saw you ask a question, so I know you know. But we are having a problem right now in the field across the country with salaries being too low, and something during the pandemic really just opened that chasm up larger. And so we've always had pretty high turnover in the field. The pay has never been particularly wonderful, but it has gotten worse. And I think from my personal experiences of this field during the pandemic, I think we experienced, much like the healthcare field, a lot of burnout. So folks leaving the field, but there is a persistent problem of salary keeping up with the demands of the job.
Thanks, Abby. We've had a number of detailed questions come in. I do want to be respectful of people's time. We were trying to keep this at 45 minutes, so I think we'll do one more question and we may send out some written answers for some of these other more detailed questions. This is for Abby, Janie, or Ra. Somebody asked, for cities making budget decisions between keeping people housed versus investing in temporary shelters, what's a better investment?
I can take a first stab. That is a doozy. In this field, we are always balancing those things, and so there's no black or white, right or wrong here. We have to have systems set up that are capable of supporting people to move from the street into housing, and we also have to be able to keep people in housing. I think I'd be interested in what, Janie, you have to say, given your work on prevention, but we have to hold this in tension and in balance, and it is always in tension and some level of balance.
Yeah, I mean, I'll just say that we have done a lot of work on preventing homelessness, and that's not exactly an answer to this question, but we do find through a variety of studies that have been published in other places that, sometimes one-time or short-term cash assistance can help a family or a person avoid homelessness, at least for some period of time, right? So those are options that every jurisdiction should explore. I think when it comes to thinking about investing in permanent housing versus shelter, there's a lot of nuance to that question that's really important. I think one interpretation of that question is, where should governments spend on capital projects? And I think most people in the field want investment in capital projects that provide permanent housing solutions. People have a right to housing, and we should be thinking about high quality exits and increasing our housing stock overall, deeply affordable housing, permanent supportive housing, affordable housing, all of the above. And when you think about building shelters from scratch, they're often just as expensive. And so if you're only thinking about that financial decision, most advocates prefer that we build capital projects that are increasing our housing supply. I think having said that, it's really important to understand the purpose of shelter. It's very different. The purpose of shelter is to help people become much more safe immediately. Living on the street is really harmful to people. It's harmful to health. It's harmful to public safety, meaning their personal safety. There's a lot of interpersonal violence that can occur. And I think one way to think about increasing access to shelter for that purpose is to create more throughput from our existing shelter into permanent housing solutions. And that's really where time-limited subsidies can play a hugely important role. If we can free up beds in our shelter system by moving people into market rate rentals or other housing exits, it creates more capacity without building whole new shelters or investing in capital projects. So this is one of the reasons why we've been so motivated to understand time-limited subsidies, because it's such an important part of the system overall. If you can take a person out of a shelter, connect them to a subsidy, actually successfully move them into a market rate rental, that actually creates a shelter bed without having to build one, from the ground up. So just some food for thought. Certainly people have lots of opinions on this. And so it's a great question, and thanks for asking it. I think that's it, Sean, right? We wrapped. We're so grateful that you all joined and were interested, and really appreciate your feedback. Super thoughtful questions. We always like to hear your feedback and questions about our work so we can improve the work going forward. And we hope to do more work on this program, try to tackle some of these unanswered questions. So, and thank you so much to Rob and Brian for leading this work, and for Abby for joining us today. We hope to see you all again soon.
Thank you.